Thanks so much,
Stop sharing.
Courtney.
You're welcome.
Really interesting talk. And it leads nicely into the last talk of the session. Rachel Calabro is with the Rhode Island Department of Health. Rachel is the program manager for the Climate Change and Health Program in the Division of Environmental Health. She also works with the Environmental Public Health Tracking Program, the Environmental Health Risk Assessment Program, and the Recreational Waters Program. Take it away, Rachel.
Great, thank you. Thank you, Courtney, for teeing up my talk very nicely. I will share my slides and we can get going. So I'm going to talk a little bit about building resilient communities and about some of the health equity work that we're doing in the health department. So I run the climate change program, and we look at a number of challenges from climate change and health. And so that includes temperature, it includes the heavy downpours that we've been seeing, the seasonality changes that we've been seeing with spring arriving earlier, and increase in asthma and allergies, more street flooding, basement flooding, more mold and moisture problems in people's homes. We're also tracking vector-borne diseases. And so we have a number of new ticks, a number of diseases that are on the increase in Rhode Island. So we work with our infectious disease program to track those as well. But really what we're looking at is climate change as a risk amplifier. So this is the Social Vulnerability Index for Rhode Island, and looking at some of these places that are socially vulnerable, we think of climate change as increasing those hazards. And so if you're already struggling to make your utility payments, if you're already struggling to afford a car and things like that, or afford air conditioning, we know that the changes coming are going to make that worse. And this is really an index of age, income, access to a vehicle, education, linguistic isolation, and things like that. And you can really track that along with some other indicators like asthma claims. We have very high asthma rates in Rhode Island compared to the rest of the country. We have very poor air quality in terms of ozone alert days. Our ozone attainment ranks us at an F by the American Lung Association. And so other metrics track along these social lines as well. And we call this the social determinants of health. And so we know that 80% of our health is based outside of the healthcare system, based outside of our genetics. It's where we live, where we go to school, the food we eat, and the social and community context in which we live. And part of that is social cohesion, civic engagement, vulnerability, policy. And so these are some of the ways that we track health equity at the health department. We have 5 domains that we track in, and these are 2 that I'm showing you here. Community resiliency includes voting participation. It includes housing units, transportation in the physical environment, includes affordability, and we also track blood lead levels. And then within the natural environment, we're really looking at tree canopy cover, and that relates to extreme heat and heat island effect in urban areas and things like that. So when you're looking at tree canopy specifically, this is the city of Providence, and you can see these are the different wards of the of the city of Providence. And then on the other side is our redlining map. These maps are available from the Library of Congress, and there are historical maps for most major cities. And you can see that the green areas are continuing today to be the areas with the highest tree canopy cover. And that tracks very closely with urban heat as well. And you can see, for those of you not from Rhode Island, the Narragansett Bay and the Providence River are on your right-hand side, snaking up through the city, with East Providence on your far right, and then the city of Providence on your left-hand side. So we also took a look at heat index, and we did this through a group called Kappa Strategies. They provided us with air temperature monitors. We drove around several areas. We took air measurements, so ambient air temperature, not surface temperature, which you can get from satellite. And then we were able to model that with humidity to get heat index values. And so this was averaged. We did this on a July day when it was over 90 degrees average temperature, and you can see where the hottest parts of the city are, and then you can track that with tree canopy and coastline and things like that. And so one of the things that we saw was that the bay certainly has a cooling effect during the day, and I don't think I don't have the slide, but it has actually a warming effect at night. And so it holds the heat in. And so downtown areas, the areas along the Seekonk and Providence River, which you see in white going up through the middle of the city, those areas were actually warmer at night. And also in areas that heated up during the day, that heat re-radiates at night. And when temperatures are over 75 degrees in the city at night, over several days, we know that that's when hospitalizations and emergency department visits start to really go up, because people can't recover from the heat of the day, and other vulnerabilities, chronic conditions like COPD or heart conditions, people start to have trouble with the heat. So one of the ways that we are focusing on this at the health department is we have what's called health equity zones. And so these are place-based efforts to really look at a community level at some of those social determinants of health. And they each come up with their own work plan based on what the community needs are in their health equity zone. So there are several in Providence based in different zip codes and neighborhoods in Providence. And there's one in Newport, there's one in the East Bay, there's East Providence. And so a lot of them are working on coastal resilience, and we have worked with a number of these health equity zones, specifically on climate resilience and adaptation, and looking at ways that they are vulnerable and ways that they can recover from storms and things like that. So here in Newport, this was at one of the farmers markets. The group did some workshops about what are the strengths and weaknesses in the community, what are some ways that we can build that social cohesion, build those community connections, and really understand how we can help each other as neighbors when that storm does come, or another disaster. So one of the things that had happened in Newport was that there was, in the wintertime, there was a natural gas outage right in the middle of this project that they were doing. And they found that the emergency management agencies, the local emergency managers, really weren't communicating with this neighborhood. This is in the north end of Newport. It's a very low income neighborhood in Newport. They really weren't getting the information. A lot of them weren't using cell phones, or they weren't accessing Facebook pages where they were being told which hotels they needed to stay at, or how to get food vouchers or things like that. And a lot of folks didn't have credit cards to get reimbursed for hotels or for food, or didn't have transportation to get places, and they had no gas service, and it was 18 degrees during the day, and they needed to be sheltered. And so a lot of people were left out of the conversation. And so since then, we have really done a much better job at trying to really get the community and the emergency managers in the city to communicate more closely about the needs and the burdens and barriers that some of these community members have when trying to access services. In Pawtucket and Central Falls, we did a project with the Green Team. This is a youth-led group out of Groundwork, Rhode Island, that did a neighborhood climate assessment. And so they went door to door to neighbors. They asked them what they needed. Some of the things they said they needed were access to food, cleanup of trash, flooding of basements, trees, and things like that. So they built raised planting beds, they installed rain barrels, planted trees, and this has been an ongoing effort to remedy some of the tree equity issues that are plaguing some of these local communities and things like that. So we're continuing our work in these communities with specifically funding projects led by community members, which is important. And then this is another, this was one of our larger tree planting projects where neighbors actually could apply for and receive trees as part of the project. And then as part of, we did a larger climate and health assessment of the tree canopy. We worked with several partners to come up with a species list for urban forests that considers better the tree species that we need to be looking at in terms of climate change. So some of those were carbon sequestration, trees that are vulnerable to pests and disease patterns and things like that, because we do have a lot of tree limbs that come down in the cities. People find trees a nuisance. People often don't want trees in their neighborhood because of some of these disease issues, pest issues, pollen issues, all sorts of things that could also impact human health. So some trees, depending on the species or the sex of the tree, could have more pollen or more fruits that then pollute and attract wildlife and things like that, and which ones provide shade and cooling and things like that. So that's an important thing to think about in, which trees are going to be the healthiest as we continue with this. So then with sea level rise, we're also concerned about some of the health impacts, including economic disruption, losing a sense of place, mental health stresses of being flooded, or even sunny day flooding or tidal flooding, and just knowing that you're losing part of what makes your neighborhood special. And we're also concerned about toxic sites. We heard about yesterday the number of gas stations, underground storage tanks, all of that stuff, septic systems that are failing, rising groundwater, all of those contributing to just generalized neighborhood stress and things like that. So I'm going to close with just a story about one project that is happening in Warren, Rhode Island, and this is a long-term ongoing project where the town of Warren has really looked very closely at this one neighborhood, which is on Main Street in Warren, where there's a number of small businesses, auto mechanic shops, gas stations, things like that. There's 400 buildings, there's 500 housing units, and 30 businesses right in this area that would be impacted by a 100-year storm and 2 feet of sea level rise. And so they know that they have to move these people out. Otherwise, there would be flooding of gas stations and building materials, and just it would be a mess if they let it degrade over time. And so one of the ideas here is that they're going to move this entire neighborhood to a higher elevation area along Route 136, which is their receiving area, on Medicom Avenue, which has the potential for 1,200 housing units and 2 million square feet of commercial, industrial, and residential rebuilding that can happen. And a lot of this area is paved, very little in terms of tree cover and very little in terms of community walkability and things like that. And so they're going to really do some deep planning to try to make the best area to move some of these businesses and homes and things like that. So, when you're thinking about these projects, really think closely and critically about who's in these areas, what are the businesses, what do people rely on in terms of their everyday needs? Is there a bakery, a barbershop, church? Do they have to use this one road like Route 103 here? You can see Child Street is basically the one road that gets you to the next town and gets you to your kid's school, and there's a lot of traffic. And when that sunny day, flooding starts to really impact these folks, how are they going to get their kids to school? How are they going to go grocery shopping? Are they going to be cut off from the only grocery store that's walkable in their neighborhood? Things like that. And so those are the things that people are really concerned about and need help with. They need access to food. They need to take their kids to daycare and school. They need to be able to access community services, and especially for elderly folk, older adults, people with disabilities. They are all living in these neighborhoods, and we need to take that into account. That is the end for me. I will stop sharing.
Thanks
Thank
so
you.
much. Yeah, thanks so much, Rachel. That was fascinating, especially that last example that you were giving, moving that whole town. Now, is that something that the locals are in favor of, or because of some of those reasons that you were giving, like the amount of impervious soil and sounds like lack of trees, are they against? So the local people in favor of being moved?
Well, it's part of a longer process of figuring out when people will move. It's a phased approach, and so there will be buyouts. There will be a certain number of there's a huge cost to the town to do this, and they will have to buy a lot of properties, but it's been very thoughtful, I think, so far.
That's really good to hear. So I think now I'll turn it over to Joe so that he can carry out a question and answer session for both of you. Thanks so much for both your talks. They were really interesting and followed nicely after Tom and Caitlin's. Take it away, Joe.
Thanks, Kathy. And thank you very much, Courtney and Rachel, for those great presentations. I'm going to check in with Joan about questions in the chat and just remind people that that's how we are going to be taking questions. So please put any additional questions in the chat. Joan?
Thanks, Joe. Yeah, there's a question here for Rachel from Jordan. Have you found that these neighborhood or community groups perceive a connection between their resilience to floods or other aspects of well-being and the condition of their wetlands and other natural resources?
It depends on how close they live to them or whether or not they have to drive through areas that are flooded. So I think, in the urban areas, they don't have a very close connection. So in the city of Providence and the city of Pawtucket, the bay is more riverine at that point, and folks don't see salt marshes every day on their daily travels, but they really identify with stormwater flooding and tree canopy and things like that. So the number of high impact rain events is definitely increasing. And I think people are definitely seeing that and feeling that. In some of these more coastal communities, like in Warren, they definitely are feeling those salt marshes migrating. I mean, they're seeing it and they're living it every day. And we do have the sunny day flooding. And so whether or not they're noticing that puddle is saltwater or freshwater, I'm not sure, but they're seeing a lot more puddles, certainly. But they're probably driving through them and not knowing they're saltwater, but but it really depends on where you live, because a lot of people are just so focused on their own neighborhood. If you don't see the bay from your neighborhood, you're not focused on it.
Thank you. There's a comment here from Caitlin. The Warren Market to Metacom project may also present opportunities for restoring, enhancing the shoreline retreat areas to improve community resiliency.
Yeah, definitely. That's part of the reason for doing it as well, is that you're removing some of those upland hazards. So the underground storage tanks and the polluting land uses, and you are providing potentially areas for marsh to migrate. And so there's going to be some work to depave and provide those marsh migration areas. And that's part of the success, I think, will be, hopefully.
Thank you. Question for Courtney. Are you tracking information on whether formalizing RAMP is further facilitating restoration efforts?
No, not officially, but that's something we could do. I think that's definitely something that we could keep track that of new collaborations formed because they now know each other through this RAMP program, and particularly as it expands, because right now these 45 people, they all know each other really well. So I think they've just worked together naturally. But yeah, no, I think that's going to be really true. And it was Caitlin who helped me stretch out that fill a need section. So like we had a bunch of needs, but have we done anything? And there's stuff definitely going on.
Here's another question, Courtney, from Kathy. Although I'm part of the RAMP group, I wonder how many members are thinking about and addressing social vulnerability in the restoration research and plans. Do you have a better sense of this type of work from members in the RAMP group?
So I agree, Kathy. I think it's not as in the forefront of a lot of members' minds as we might think it would be based on how much we are collectively talking about it outside of RAMP. And I think that's because a lot of our RAMP members, they're on the ground, they're doing their work. And so I actually, from this meeting yesterday, we had Simona and Kate, and I was like, those could be good to bring them to RAMP and have them start talking with us through social vulnerability and how we can build into some of our projects that interdisciplinary look to really think through some of the things that even Rachel brought up. Like, if you're not seeing the bay, do you really know it's there? And we can kind of work through a lot of that to build out our restoration efforts going forward and bring them a little bit more wraparound to not just the habitat, but the people as well.
Yeah, great idea. I think inviting Simona and Kate to future meetings, and Rachel too. I mean, I hadn't thought about how flooding might cause asthma or respiratory problems, with molds. So, salt marshes provide flood abatement. And, if there's places their basements are flooding and mold is building up in areas, certainly sounds like it would have health consequences. What do you think about that, Rachel?
Yeah, definitely. We do have a housing crisis in Rhode Island in terms of both affordability and age of housing. And we know that folks don't have a lot of money to fix up their homes if they are in these lower income areas like Warren, the place that I showed, and a lot of it's rental units. And so landlords are not keen on necessarily remediating molds as well as some tenants might want them to, I guess.
Yeah.
So housing, I think in general, housing and health are just so interlinked, and where flooding impacts housing, it definitely impacts health. And the mental health aspects of this too can't be ignored.
Mhm. Thank you.